Welcome to my YouTube channel, Everything Medical. Today's video, we shall be looking at the practical ways, the standard ways to attempt anatomy essay in exam. So this video is for both medical students, for Mbbs students and also BSc students who offers anatomy in their 200 level and also in 300 level, right? So before I start telling you how to attempt anatomy essay in the standard way, you have to subscribe to our channel. Yes, subscribe to our channel and also share our videos. Yes, so that other students can also see it and get their pressing issues on the areas of human anatomy done. Recall that this channel will also treat medical biochemistry and also physiology. Now let's proceed. Anatomy is divided into three. Basically, it's divided into three areas or into three segments. We have the gross anatomy, which is majorly for the structure. We have the embryology, which is majorly for the development of those structures, how they evolve. We have the histology, which is all about the linings and the tissue level, right? And the cells. Histology can be called microscopic anatomy, while gross anatomy can be called macroscopic anatomy. Now, these are the questions in your exam usually come under these headings. Is either you are being asked a bone or joint or muscles or space or sheath or arteries, veins and nerves. Likewise, questions in embryology will generate from general embryology and also systemic. While questions from histology will also come from general histology and also systemic histology. Now, the outlines I'll be giving here and standard approach to attempt those questions are basically coming from the structures under these headings, right? Let's begin with bone. On the area of bone, immediately the long bone, right? The long bones, such as the femur, the humerus, the tibia and fibula, and all that, they are long bones, right? The first thing you are going to do when you are being asked anatomy essay as a long bone is to draw the diagram. And it's diagrams, like two diagrams, depicting the two surfaces of the bone, because almost all the bones have two surfaces, either the anterior and the posterior surface. So diagrams must be there. That is the first thing you do. And it is S because it is more than one diagram. That is why it's bearing S, diagrams. The next thing is the introduction. Since it's a long bone, right? The next is peculiarity. Peculiarities, followed by the ends. After the ends, what follows is the shaft, because it's a long bone. After the shaft is the surfaces, because it's more than one surface. The borders, the blood supply, nerve supply, venous drainage, muscle attachments. Muscle attachment, we have ossification centers, and lastly clinical stroke applied anatomy. Now watch, you are free to disarrange this outline in exception of these two and this. Clinical and applied anatomy must always come last. It must always come last, while diagram and introduction will always come first. You are free to disarrange all these ones. You are free, but do not bring clinical anatomy at the first place and bring diagram in your last place. So diagrams and introduction will come first, whereas clinical and applied anatomy will always be the last. Okay, now on the area of clinical and applied anatomy, for bones, you are expected to, in fact, everything you are writing in human anatomy, you are expected to write at minimum 5 clinical and applied anatomy. That is the standard. And there are clinical anatomy that is peculiar for all bones, such as osteoporosis, osteomalacia, osteosarcoma, osteomyelitis, bone metastasis, fracture. So those are the clinical anatomy that is associated with every bone. For the fact it's a bony structure, you can write it in any of them. Now, on the case of flat bone, for example, the scapula does not have shaft and end, right? So, but it has an angle, right? It has an angle. So you can remove the ends and shaft in this outline and include the angles of scapula so that it will suit in with the outline of scapula. That is for the case of flat bone, right? But I majorly said here is for long bones such as clavicle, humerus, the femur, tibia, fibula, all that, on and radius. So that is it. On the area of joint, diagram will come first. Diagram will come first because that it is not diagrams, it's one diagram. What to follow next is introduction. You have to introduce it. After introduction, since it's a joint between two surfaces, so you have to write down the what? Articular surfaces. So articular surface will come again. Articular surface. The next to follow is the ligament. Ligament, right? After ligament, what will follow next? It is the stability, because it's the joint. Something must stabilize it so that it will keep on performing its what? Function. So stability. After stability, we have relation, because it's a joint. We must have relational structures. After relation, we have nerve supply, blood supply is usually the arterial supply, venous drainage also, right? The next thing is movement, because it has movement, either medial and lateral rotation, abduction and what? Adduction rotation, right? And if it's a circumduction movement, which also be there, so movement. Because that this outline is applicable in all joints in the body. It's applicable in all joints in the body. The last one is clinical stroke applied anatomy. You have to write at minimum 5 clinical stroke applied anatomy for this area, right? So there are clinical anatomy that is associated with every joint, especially synovial joint, such as arthritis is for joint. We have adhesive capsulitis. We have bursitis. Those are the clinical anatomy that is associated with joints, especially synovial joints, such as the shoulder joint, the hip joint. They are applicable to it, right? So these are the standard and outline in writing joint essay in anatomy essay exam. That is it. Now let's move to muscle. Diagram will always come first. Diagram will always come first, followed by introduction. After introduction, since it's a muscle, it must have origin. It will have what? Insertion. It will have nerve supply. It will have blood supply. It will have venous drainage. It will have action. It will have clinical testing. Clinical testing. But not every muscle has clinical testing, right? So next is the clinical and applied anatomy. clinical stroke applied anatomy. I've said previously that you can disarrange the middle outlines, but do not disarrange diagram and introduction and clinical anatomy. Clinical anatomy should always come last, whereas diagram and introduction should always come first. In your exam, when you write this outline, because you're going to write them apart from the diagram, right? Like what I'm saying is that you draw the diagram, right? You draw it. Now, the next is the introduction. You write it with either in capital letter or small letter. Then you underline it. Underline it with both lines so that they will see it. The marking scheme of anatomy essay is dependent on how you outline your work, because that is one of their cardinal marking schemes, so that you get your full mark. You have to either capitalize it or you underline the bold so that they will see it, because what they're using to mark your work is based on outline you gave. You don't write anatomy essay like physiology or biochemistry. You have to outline those structures. Now, the next is the space. Space are so essential. Space are mostly used for clinical assessment, such as checking the blood pressure and other clinical assessment. Space include the cubital fossa, the popliteal fossa, the femoral triangle. There are spaces, right? There are spaces. The adductor canal, the anterior cranial fossa, the middle cranial fossa, and the posterior. There are spaces in the human body. So space will have diagram. Yeah, diagram will be there. Whatever you are writing on human anatomy, like anatomy essay, diagram is essential. Diagram is a first, because those structures are found in human body, so you have to draw it for them. So diagram, introduction. Since it's a space must have an apex and the base, roof and floor. So apex, base, roof and floor. A space must have contents. There are contents of the space. Contents. Space will also have what? Boundary. Boundaries. A space will have clinical stroke applied anatomy, right? So these are the standard outline in writing anatomy essay that involves space. So because that I said previously that you should always make diagram and introduction to be first, while clinical and applied anatomy should be the what? The last. They should always appear last, the last outline. Okay, so let's go to the sheet. Sheets are similar to space, but is not a space. They share similar outline with spaces, such as the rectus sheet, the carotid sheet, and all those stuff, right? So we have diagram. Diagram will be there, right? We have introduction, we have apex, we have the base or the floor, we have the floor, we have the roof, we have contents of the sheet, we have boundaries. Finally is clinical stroke applied anatomy. So you can see that they share the similar outline with spaces, right? Now let's dive into artery, veins, and nerves. This area is also essential in human anatomy. In writing anatomy essay that is dependent on these structures. So first is diagram. If you really want to make your anatomy essay to be standard, don't forget outline. Outline will make you to recall and remember things you have read. You don't just write something on the paper and expect them to mark it for you. No, outline it. Even if you outline your work and you don't write enough information on the outline you gave, it's cool, right? So you have to work based on the outline you are writing. So diagram, introduction. Since it's an artery, vein and nerve, it will have an origin, it will have a course where it transverses or passes through, it will have termination, it will have branches, it will have relation, it will have what we call clinical and applied anatomy. Clinical stroke applied anatomy. Now these are the standard outline in writing either an artery, any artery in the body, any vein and any what nerve. These are the outline you use. So do not mistake them. Do not mistake them. It's essential. Remember these outlines in exam. It's so essential, right? So we are done from gross anatomy. Let's go into embryology. Now watch. On this embryology, in the questions coming out from an embryology in your exam, be it a professional exam or an in-course or a quiz, you have to follow this outline, both for MBBS students and for BSc students. Now, on general embryology, first is diagram. Diagram will always come first. Diagrams, because some of those diagrams in general embryology is more than 1, 2 or 3, 4 because of their stages and all that. So we have introduction. After introduction, what next? The period. At what period does it occur? Because this is general embryology. It is not systemic, right? It's not systemic. So after period is site of occurrence. At what region, at what place does it occur? Site of occurrence. After the site of occurrence, what will happen is the event. This event is so what? Essential. This event is where you tell everything. Both the stages are here. This event is where you're going to explain everything that happens on the question you are writing on, such as spermatogenesis, oogenesis, menstrual cycle. This is where you write the types of the menstrual cycle should be on this event, right? I mean the phases of menstrual cycle, not the types, the phases, right? This is where you write them. Even spermatogenesis, all of them are under general embryology. You should add it here, right? So after which, what follows next is clinical stroke applied anatomy. I mean clinical embryology. Clinical embryology, right? So this is how it goes on the general embryology. On the systemic, diagram will also come first. It is more than one diagram. Introduction. Now the next is the period and lining, the epithelial lining, right? The epithelial lining, is it endoderma, is it mesoderma, or what? Ectoderma. You have to tell them the lining. Okay, the next is the event. Event is where you're going to explain the diagram you have drawn. This is where event is where you explain everything, whether it has stages or not. This is where you explain it on the event, right? So last is clinical embryology. Clinical embryology, right? Now let's go to general histology. On the aspect of general histology, diagram will come first. diagrams. You have introduction. We have components. We have features, and also clinical histology. So, for example, on epithelium, if writing epithelium, you have to follow this outline. On these features and components, that is where you tell everything about the epithelium, the types of the epithelium, the simple epithelium, and stratified epithelium. You have to tell those stories and other classifications, because epithelium is a broad general histology. It's a broad general histology. I've done the video. Do well to watch it to give you an insight and overview on what epithelial tissue is all about. So this is the outline. On the area of systemic histology, we still have diagrams, introduction, microscopic features, clinical histology. Now you have to understand that the diagram you draw on histology is quite different from embryology and gross anatomy. On the area of histology is mostly those photomicrographs. That is those things you saw on the slides of microscope of a particular tissue. That is what you are going to draw. You don't bring the structure or the diagram of gross anatomy or embryology to draw on histology. It's quite different. It's quite different, right? So you have to understand that the microscopic features are those things you saw on the features of those slides or the photomicrograph you saw on the microscope. That is what I'm trying to tell you, and that is why it can be called the histological features. It can be called what? Histological features, which is the microscopic features. Now, the microscopic features are more of the gross anatomy feature of what we are discussing on the histology, right? So, on the area of clinical histology, we have things that you should write about, such as metaplasia, hyperplasia, anaplasia, polyplasia, those misbehavior of cells and tissues. You can add it there. It occurs in every tissue. Metaplasia, hyperplasia, hypertrophy, all of them occurs in any tissue, right? So you should, even if you forget a certain clinical anatomy for the particular structure or question you are writing on, you have to add other ones that are general. I've told you that a medical board exam or any exam, in course or quiz or whatever, write at least 5 minimum clinical and applied what you are writing. So that is it. Now let me come back to area of artery. On the area of arteries, there is a peculiar clinical anatomy that is fundamentals for arteries, such as aneurysm, even self arteries and veins per se, such as aneurysm, embolism, thrombolism, ischemia, ischemic necrosis, coarctation, collateral supplies. Those are peculiar clinical anatomy that occurs in every artery, so you can add it up. For example, brachial artery, we have peculiar clinical anatomy for brachial artery, which is Volkmann's ischemic contracture. That is the supracondylar fracture of the humerus. Where humerus fractures at the mid shaft, it causes occlusion of the brachial artery, called Volkmann's ischemic contracture. That is peculiar for brachial artery. Now you could add other ones, such as the aneurysm, thrombolism, and all the rest. Even for clinical assessment, in measuring the the pulse rate and all that. You can add it on brachial artery, right? That is for peculiar for brachial artery, whereas you can add other ones that is for general for other arteries, even the veins, right? So that is how it works. I believe with this you can know how to attempt your question in anatomy essay. Every anatomy essay you are writing revolves around these outlines. This is our standard. Do not cajole it, right? You have to work on it, and as you study, you work on it effectively so that you know, because when you understand these outlines, you will be good to go in any exam you're writing in anatomy, especially anatomy essay. Because MCQ, you don't write anything in MCQ. So that is it. Thank you so much for staying to the end of this video. I really appreciate. Thank you.